Good morning, everybody. I'm Dr. Kusumvalli, Professor and Head, Department of Conservative Dentistry and Endodontics, Sri Rajiv Gandhi College of Dental Sciences and Hospital, Bangalore. This session, we deal with home bleaching. This is in continuation with the earlier session on bleaching that we have started off, and this is very useful for the final year students. So night guard bleaching is also called as home bleaching technique, and it was initially introduced by Dr. Van Haywood and Dr. Harold Heyman in 1989. This is a dentist prescribed home bleach technique. The bleaching tray is prepared and material is dispensed along with a follow-up appointment for checkup. So there are many materials that are available in the market that can be utilized with this technique. You use various concentrations of carbamide peroxide, 10%, 15%, 20%, and 25%. So the first step in home bleach technique is the preparation of the bleaching tray. So in order to prepare a bleaching tray, you have to take an impression of the patient's upper and lower arches. You can prepare an alginate impression. After the impression is prepared, a model is poured. So on the model, you will mark out the gingival margin. You will also take a light cure blockout resin. This light cure blockout resin is placed in the middle as well as the incisal thirds. You're leaving away the cervical third. So this space will be available as a reservoir for the bleaching material to be placed when the tray is placed inside the oral cavity. The bleaching tray is prepared in the laboratory. The equipment to prepare the bleaching tray is referred to as a biostar. There are different types. There is different equipment. This is an example of the equipment that is utilized for preparing the bleaching tray. You've got transparent sheets of varying thickness to prepare the bleaching tray. Your model is given to the laboratory, and the transparent sheets they have procured, and it is placed. So the model is placed as well as the transparent sheet is placed, and the model and the tray and the material are placed in position. And the tray is molded according to conforming to the dimensions of the patient's teeth, and you've got the bleaching tray is ready. So this bleaching tray is provided by the technician from the laboratory. Once you have obtained your bleaching tray, it's extremely important again to check the fit, and it should cover the gingival margin, and it should completely and snugly fit the patient's teeth, because there should be absolutely no leakage of the bleaching material. So the trial fitting in the patient's mouth is a very important step. After you have checked the fit of the bleaching tray, you make use of these syringes, and these syringes which are available, 10% and 15% are available. 20 and 25% is also available. You can see here there's a syringe of 35% hydrogen peroxide. This is more so used in the office rather than at home. The lower concentrations are used at home. So this syringe is given to the patient, and the patient is given instructions as to how to use the bleaching material. All the instructions are given to the patient. The patient is asked to brush the teeth, floss the teeth, and apply the bleaching agent. This is the syringe that you have provided. This is the syringe that you have provided to the patient. So you ask the patient to just dispense about a drop of the bleaching agent onto the inner surface of the front teeth, of the anterior teeth. Just drop by drop is placed on the inner surface of the bleaching tray. And after you place the bleaching agent, it is inserted. The patient is instructed to insert into the oral cavity onto his teeth and make sure that it is snugly fitting. And when they are not using it, it has to be washed, and it has to be placed in a clean container containing water. The patient is instructed to wear the bleaching guard for at least 3 to 4 hours per day or overnight. It is ideal to wear it overnight. If the patient is not ready to wear it for the whole night, then he can at least wear it for about 3 to 4 hours. So you have to monitor the patient, and the patient can be checked every 2 hours and you have to check how the teeth have changed color. As I've already told you, 10% carbamide peroxide is used for this technique. It can be increased to 16% or up to 20% as per the case requirements. And patient is requested to inform the dentist of any problems of hypersensitivity. Patient has to indicate to the dentist, and we can again alter the concentration according to the patient response. So achieving this is rather easy with this home bleach technique. You can see a slightly yellowish brownish generalized stain of all the teeth. So you have got an improvement of color from this to a lighter and a whiter shade. So you cannot make use of this technique for very dark discolorations. Again, it is only for light or mild yellowish brownish stains that you can use this particular technique to achieve an improvement in color. We shall also talk about non-vital bleaching. It's also referred to as intracoronal bleaching because you've got the inside of the pulp chamber available after endodontic treatment for the bleaching agent to be placed. So after endodontic treatment, this is a very common occurrence where you see an intact tooth, but a blackish to grayish discoloration because of endodontic treatment. You want to achieve an improvement in color. Yes, you have different options for this kind of scenario where you have the tooth is intact, endodontically treated, endodontic treatment is successful, but you want the patient is seeking an improvement in color. For these kind of cases, it is very good. This technique is very good because there's no loss of tooth structure here. So you do not have to make use of any other technique like veneers or crowns, wherein a certain amount of tooth structure is removed to prepare and place a veneer or a crown. Here in bleaching, you place the agent inside the tooth structure as well as on the external surface of the tooth structure and bring about a change in color without any loss of tooth structure. So that's why it's called as a minimally invasive procedure. So what are the agents that are utilized for non-vital bleaching? The agents that are commonly used for non-vital bleaching or intracoronal bleaching or walking bleach are referred to as sodium perborate, hydrogen peroxide 30% to 35%, or you can make use of a combination of these two agents. So non-vital bleaching can be brought about by what is called as the walking bleach technique. Another technique is the thermocatalytic technique. So we'll go into the details of each of these techniques. So prior to starting off with the technique, you have to assess radiographically the status of the periapical tissues and the quality of the endodontic obturation. So your periradicular healing should have taken place by this time. And if you have not done the root canal therapy, you have to make sure that you have a good radiograph and which shows that there's a proper 3D obturation of the root canal system. Contraindications to non-vital bleaching would be if there is a very small amount of remaining dentin or there are extensive restorations on the tooth, then this is not a technique for bringing about a change in color. So there should be an intact tooth but discolored, mild to moderate. So this is a typical scenario. You got a minimal amount of loss of tooth structure, endodontically treated, right upper central, left upper central. You establish the shape prior to starting off the procedure. Take radiographs and record the shape before you start off the procedure. You have to isolate the tooth and all the restorative material from the pulp chamber is removed to expose the dentin. And you can also refine the axis if it is required. So you have to remove the contents of the pulp chamber. After you have removed the contents of the pulp chamber, you have to place a GIC base at least 2 millimeters thick in order to cover the endodontic obturation. And this base has to be at a point below the CEG. After you place the base, you have to prepare a paste for this walking bleach technique, wherein you're mixing the sodium perborate and hydrogen peroxide, or sodium perborate is mixed with sterile water and placed inside the pulp chamber. And after you place the mix inside the pulp chamber, you're placing a double seal. You're placing this double seal in order to prevent any leakage of the material from inside the pulp chamber to the external surface of the oral cavity. So what is suggested is, instead of using hydrogen peroxide and sodium perborate, most important is to use sodium perborate and water. The reason is you want to avoid any kind of external cervical resorption, because when you use sodium perborate and hydrogen peroxide, there have been instances of external cervical resorption. So this is referred to as walking bleach. Why? Because after placing your GIC base, you're making a paste of this bleaching agent and you're placing it inside the pulp chamber and sealing it with a double seal and sending the patient for a couple of days. So the patient walks away with the bleach inside the pulp chamber. That's why it's referred to as walking bleach technique. So you place the bleaching material inside the pulp chamber and then seal it with a double seal. And that's why it's referred to as walking bleach. We'll just see a couple of clinical cases that we have done in the department using this technique. You've got this clinical scenario wherein the patient has undergone an endodontic treatment. The endodontic obturation material seems to be adequate. The tooth is intact and discolored. You make a solution of sodium perborate and distilled water, or in this case, we have made use of sodium perborate and hydrogen peroxide. You place it inside the pulp chamber. And after placing it for about 3 days, we were able to change the color of the tooth from this grayish brownish to white. This is another clinical scenario where we have a discolored tooth after endodontic treatment is completed. We have checked the periapical status. It is adequate healing is there. We've removed all the chamber contents. We've placed a base, a GIZ base, placed a mix of sodium perborate and water inside the chamber, and we've been able to achieve a color improvement from brownish to whitish. This is another case scenario where the endodontic treatment is completed for the right lateral incisor. We placed a mix of sodium perborate and water, and we were able to achieve this improvement in color in about 2 visits. So that's for the walking bleach technique. If successful result is not achieved, then the procedure is repeated not more than 3 times. Once you have achieved adequate success, then the temporary material is replaced with a permanent restoration. The postoperative complications that I was talking to you about is referred to as external cervical resorption. So you can avoid this external cervical resorption if you make a paste of sodium perborate and water rather than sodium perborate and hydrogen peroxide. So what happens is the hydrogen peroxide, if there are any discontinuities on the external surface, it is possible for the free radicals to pass through the tooth and bring about this external cervical resorption. So this is an unfavorable result that you can see, and that's why it's important to avoid hydrogen peroxide in walking bleach technique. There's another method wherein you can bring about bleaching in non-vital teeth or endodontically treated teeth, and it is referred to as a thermocatalytic method. It is very similar to the thermocatalytic method that we have discussed in vital teeth. So after isolation and application of a protective base, here we have the chamber as well that is available to us to place the bleaching agent. So you can place cotton fibers inside the chamber, and that can be saturated with hydrogen peroxide and activated with a photoflood lamp in order to initiate the activity of the hydrogen peroxide. And you can place this photoflood lamp for about 5 minutes. So this process of office bleaching can be done for about 5 minutes each session, and you can do it for about 4 to 6 times for a total of about half an hour. In difficult cases, you can place a cotton pellet saturated with sodium perborate and water and send the patient. So that's a combination, wherein in the office, you do thermocatalytic technique, and subsequent to completing the thermocatalytic technique, you place the sodium perborate mixed with distilled water inside the pulp chamber and send the patient and ask the patient to return in about 3 days. So the question comes as to, is bleaching safe methodology to bring about a change in color? Absolutely, it is a very safe technique. We can bring about an improvement in color with absolutely no loss of tooth structure. So that's why it's referred to as minimally invasive technique. And provided your treatment protocol is right and your diagnosis is also very important, you can bring about a change in color for mild and moderate discolorations. So case selection is of paramount importance, and patient's expectations also has to be taken into consideration here. So definitely it is a very safe technique. So this technique definitely we spoke about the method of bringing very good results in your patients for their safety as well as improvement in their color. And thank you very much for a very patient hearing.